We're not going to talk about the post-op period after your operation. We're going to start that night, and we're going to go on to forever. And we're going to talk about what you can do to make yourself better. So let's get started. So what can we do the night of surgery to make you feel better and get you set up to have a better recovery? Well, the first thing we can do is get you up and walk you. Okay? That's really good. Why? Because it cleans out your lungs, which just had anesthetic in them, so you don't get a pneumonia. It cleans out your legs, because you're pumping blood up and down your legs, so you don't get blood clots, which could really ruin your day. Okay? However, in order to get up and walk, you're going to have your pain under control. Okay? So be very, very open about asking the nurses for some medicine. Okay? They're very good. They'll give you as much as you need, and they're really good at kind of inching you right up to the point where you're comfy, but you're not zoned. So keep talking to them and keep working with them. Get yourself inched up to the point where you're comfy and you're not zoned, and start doing some laps around the ward. What can we do the first week to keep feeling better? Well, on our YouTube channel, there's an ACDF playlist. We've got 2 vids on it, which you ought to look at. It talks about a cycle, okay, a 24-hour cycle of medicine, of ice, of walking, plus other tips. Get on that cycle. Stick the PDF, which we have, download that, print it off, put it on your refrigerator, and just start checking off little boxes as you go along. And if you get yourself on that cycle of ice on your neck, walking regularly, and the interlocking medicine, if you take the narcotics and then you take Motrin Tylenol in between, you're going to wind up feeling a lot better, a lot faster. So now it's week 2 to 3, okay? We've already seen you once in the office. You can drive, presuming you're not wearing a collar. If you are, quit smoking. And now you're thinking about going back to work. Start with part-time. Start with light, okay? The standard rule in running is you add about 10% per week. Okay, so if you just gradually increase your activities, increase your workload by about 10% per week, you'll be doing fine. The other thing we want you to do is to let the super glue on your neck flake off on its own. Why is that? Because if the super glue sticks around for 2 to 3 weeks, okay, then it supports the edges of your scar, okay? It's providing that extra little bit of support so that when your skin cells heal across that scar, they make a very thin little scar. Sometimes you can't even see it at 6 months, okay? So leave it on. It looks like hell. Accept that it's going to look like hell for 2 to 3 weeks, but if it looks bad now, it's going to look great in 6 months. Now let's talk about what's happening out at 2 to 3 months. Okay? This is a key transition time. By this time, you should be doing some therapy. Physical therapy, chiropractic, whatever kind of therapy you want. There are 2 things I want you to do in therapy. The first thing is to go to the sessions themselves, because they're very helpful. More important than that is to do your homework. Why are you doing homework? The most important thing you can do with your homework is establish new habits. Google that, okay? As it turns out, past 5 years, there's a lot of work being done on new habits. If you consciously, deliberately do things, practice doing it consciously for a period of about 8 to 12 weeks, okay? Then that new habit gets ingrained and it sort of fades into your background processing. It's there, you're just not thinking about it. So things like posture, ergonomics at your work, ergonomics at your home, ergonomics at when you're digging in the garden. all those things. You're going to be paying attention to your neck anyway because you just had an operation. Judo that attention into establishing new habits. So now we're at month about 4 to 6, okay? And you're starting to feel pretty good, and you're starting to regain your normal activities. But the most important thing I want you to remember for the first 4 to 6 months after your anterior cervical discectomy is no bouncing. What am I talking about? I'm talking about things like running. Sorry, runners. Thinking about Zumba. If you're jumping in Zumba, we're talking about bouncing on something like a snowmobile, a jet ski, a lawnmower, a regular boat. If you go out on the lake and start pounding over waves, okay? No bouncing. Why? Because what's happening, remember, okay, these are your vertebral bodies. This is a little implant we put in. Oops, hold on. There we go. There's a little implant we put in there, okay? And what is your body trying to do? Your body's trying to grow new bone right through here, okay? And if those new bones get fractured by a bounce, okay, then you're going to have a fractured bone trying to grow through this implant, and that can be a real bad problem. You might need further surgery in the future, get a really bad outcome. So again, no bouncing for the first 4 to 6 months. So for the first 2 years after your anterior cervical discectomy, when you go to the dentist, you should have antibiotics. Call us, we'll prescribe them for regular dental work. As it turns out, this really decreases the probability of an infection in the implant material we put in your neck. And finally, forever, I want you to do a couple things. Number one, no smoking. We're going to try real hard to get you off cigarettes initially. In fact, bring a friend along so you can both stop smoking. Okay? And the other thing we want you to do forever is good mechanics. Because we love you. We don't want to operate on you again. Okay? So work on your ergonomics, tune them up, establish good habits, and keep tuning up those good habits forever, and we'll see each other somewhere on the running trail. Okay, so the usual disclaimer: you watching this video does not make me your doctor. Use common sense. If it hurts when you do that, don't do that, and always keep in contact with your own healthcare provider throughout this. So we are all over the web. We have a very active Facebook page with our patients. We are big time tweeters, and we are way into Instagram. To see more videos about anterior cervical discectomy surgery, general spine info, our blog, or to contact us, just hit us at DoctorRodz.com.